Equipoise, Boldenone. Main uses: 1. Mass gain. Boldenone is a good mass-gaining steroid. It increases IGF-1, suppresses glucocorticoids, and amplifies nitrogen retention. It is also a lot more effective than many other steroids in increasing the levels of RBC in the body, a trait that has also led to some concern about some users. The main advantage of using Boldenone over other mass-gaining steroids like Deca and Test is that due to the weak aromatizing nature, it hardly causes water retention. So if you can control the minimal bloat with Boldenone, you can make some serious dry muscle gains on the cycle. 2. Strength and recovery. We have seen many professionals use EQ in their off-season bulking plans because of the weaker androgenic rating, which makes it easier to control, and its ability to promote strength gains, lean dry muscle, and a reasonable increase in strength. Sounds like the perfect steroid for athletes who aren't bothered about the 5-month-long detection time. EQ also aids in recovery. 3. Body recomposition. One of the lesser-known properties of the steroid is protecting lean muscle tissue during an aggressive cutting phase, with the strength gains and very little water retention and slight conditioning effect, which can further be amplified by using a finishing steroid like Mast. You can completely recompose your body with EQ. Side effects: estrogenic. Despite having a 50% lower rate of aromatization than Test, EQ can still aromatize, and even the slightest possibility of aromatization must be looked at with the same caution. Keep a SERM handy before you begin your cycle. If you notice any symptoms like bloating or itchy puffy nipples, then start with the SERM to prevent it from aggravating into full-blown gynecomastia. If you are unable to control it with a SERM, use an AI. Androgenic. Once again, there's a much lower possibility of EQ causing androgenic side effects, but the possibility does exist, particularly if you are genetically predisposed towards it. A5-alpha reductase inhibitor like finasteride might be able to control some of the androgenic side effects. On a positive note, EQ is not liver toxic, nor does it exhibit the same severity of cholesterol-related side effects as many other anabolic steroids. Dosages and stacks. The ideal beginner dose of EQ is between 200 and 400 milligrams per week. It is a slow-acting steroid, so it will be a few weeks before you start noticing the effects of the drug. More experienced users might increase the dosage to 600 milligrams per week, but we personally never vouch for anything more than 600, not unless you are a competitive bodybuilder. An EQ cycle typically lasts for 12 to 14 weeks. EQ is rarely used in a solo cycle. It is clubbed with other base steroids. One of the simplest cycles that you can do is Test, E, and EQ for 14 weeks. Keep the EQ dosages slightly lower than the Test.